Okay, so basically my opponent's main claims have been that embryonic stem cells are the only option for curing these diseases and for studying the human anatomy. And they're basically saying that, we're going to not look at that nasty little ethical side because it's mainly about the funding. The problem is that ethical side still exists, and these stem cells are not the only option. So if it were that the embryonic stem cells were the only option that we had, then maybe the ethical dilemmas that we're facing wouldn't be quite as important. But the fact is, the government stated in their human life bill, they passed a bill saying that life starts at conception, which means that when this embryo, which is 5 days old, is destroyed, you are destroying life. And unfortunately, these embryonic stem cells, they're not the only option, because adult stem cells and the induced pluripotent stem cells are they have basically eclipsed the value. According to Dr. Bernadine Healy, who wrote for Health News, the iPS cells are so embryonic-like that they can also turn into any of the 220 cells. And these reprogrammed cells have already eclipsed the value of harvested embryos because of significantly lower cost, ease of production, and genetic identity with the patient. My opponent mentioned that there would be less risk during organ transplants because the body wouldn't reject the cells. Unfortunately, when you're using embryonic stem cells, that's not your DNA. That's the DNA of this baby or this embryo that is going to turn into a baby. It's not you. Whereas opposed to the adult stem cells, which come from you, and the iPS cells, which would come from your own skin cells. So these ones would not, those would have your own DNA. Basically, when you're using embryonic stem cells, according to Mike Frumento, who wrote The Dirty Secrets of Embryonic Stem Cell Research, these cells, any treatment would require the use of dangerous immunosuppressive drugs, which have a nasty tendency to form tumors, both malignant and benign, combined with, like I earlier mentioned, the fact that the embryonic stem cells themselves could possibly give you cancer, as it has been shown with the little boy in Israel, as well as tests have been shown of causing tumors in animals, according to 3 doctors who gave a speech about what taxpayers should know about federal embryonic stem cell research. The fact is, all of these diseases that they're claiming that embryonic stem cells can treat can be treated by adult stem cells and have been being treated by adult stem cells for many decades. And there have been significant advancements with the iPS cells and with cord blood cells, like my partner mentioned earlier. Another minor claim that they had made was about job creation, and the fact that's part of the problem. Like I said before, most of the government funding goes into creating the bureaucracy. And most of this money, according to Siegfried Frey-Revere, who wrote Funding Embryonic Stem Cell Research for a biotechnology magazine, said that most of the funding goes to training researchers as opposed to actually for the research. I'd also like to point out that in vitro fertilization was never had government funding. So when they say that the important part about this is that it needs to have government funding because private funding isn't enough, in vitro fertilization is a $16 billion a year industry and never had a dime of government funding because the government refused to fund it. And I think that's what we need to do today. We need the government to refuse to fund this research because it is unnecessary and it does kill life.